Marvin?
We're live.
Good evening, everyone. This is Mayor Shawyn Patterson Howard. I am going live tonight, and we will be speaking about COVID as well as the census. Here tonight on the show, we have several of our county legislators. We have our county legislator, Colin Smith from Peekskill. We have our county legislator, Christopher Johnson from Yonkers. We have our county legislator, Terry Clements from New Rochelle. We have our county legislator, Lyndon Williams from the incredible city of Mount Vernon. I'm a little bit biased. And we also have on the phone, but you cannot view him, our county legislator, Jose Alvarado, also from the city of Yonkers. And so we're asking right now that as we start to go forward in our Zoom and our Facebook Live conversation, that you please share your video, share the video with your friends and with your families. If you could share the video or start a watch party, we'd greatly appreciate it. So we're going to give you about 15 to 20 seconds to do that, to start to share the video, and then we're going to start.
I'm looking for it.
Yeah, I don't see it on my page yet, Malcolm. I guess it's taken a second to come up.
Sure.
Will we be able to just get it, find it on your page?
Yeah, it should be on the Mayor Shawyn Patterson Howard page. It's there now. It just came up. And so everyone, just again, we have our county legislators, several of our county legislators here with us tonight. So whether you're from Peekskill, New Rochelle, Yonkers, Mount Vernon, White Plains, Greenburgh, anywhere in the county, these are our county legislators that represent different districts, but they all work together to represent the county of Westchester. And tonight we will be speaking about what we've all been speaking about for a while, which is COVID-19, as well as the census. And again, just for those who are just tuning in, we have our legislator, Colin Smith from Peekskill. If you could wave, Colin, so they know who you are. Our county legislator, Christopher Johnson. Chris, he's from Yonkers. Our county legislator, Terry Clements from New Rochelle. Our county legislator, Lyndon Williams from, again, the great city of Mount Vernon. And who you cannot see is our county legislator, Jose Alvarado from Yonkers, New York. And so we're going to jump into this and start. So here in Westchester, we know that Westchester has been hard hit. We have been hardest hit outside of New York City in the state of New York. We have, from last report on Friday, over 18,000 cases here in the county of Westchester. And I would say that is a big number by anyone's accounting. We have more numbers in Westchester than several states have right now. And so Westchester has definitely been greatly impacted. And I just want to kind of hear, you know, Legislator Clements, a lot of this came to light in New Rochelle. That was one of the first places where we saw big numbers and where there was a coordinated effort in New Rochelle. Can you tell me how you guys are doing in New Rochelle? And what are some of the things that you've done to kind of help the citizens and how to get out in front of this?
Okay, so the first thing they did was identify how so many people were infected by the attorney that had traveled overseas to Israel, then to Miami and returned home, and had gone to bat mitzvah, had also gone to a funeral and attended. And just from that one person, 400 people were impacted by that and had to be quarantine. Several individuals were actually later to be found COVID positive. So the first thing that we did here was to isolate the area surrounding a mile radius around the town where he attended, and we shut down 3 of the schools in New Rochelle initially to try to isolate everybody. And because it was one of the first places, we got a lot of support from the governor. We were the first ones to have a testing facility in Glen Island. So for us, a lot of people came very quickly to work with us. And I can't really say that that's necessarily true for the Black community. And, I'm very happy about what we've done here with the Mayor Noam Bramson and George Latimer being supportive. But as I said to you at a previous call, my biggest concern right now is that there is a rumor that had gone around in the African American community that African Americans were not getting this virus. So one of the things that I did was contact my cousin, who is a surgeon in Washington, D.C. And he, at that time, said he hadn't noticed that African Americans had been getting the virus. Dr. Marshall now says the reason for that was because it started in New Rochelle, it was in the Northeast, and not hit DC in the way that it has now. And he sees that our community is being impacted in a great way. My concern is that people, it's a health crisis, but also how we need to go forward and look at it. It's also a financial crisis.
Absolutely.
And I think we have a lot of resources in the Black community that we're going to need to pull together to address this crisis. And so going forward, more than what's happened in New Rochelle, I'm concerned about going forward and what we need to do to support people right now. Legislator Lyndon Williams had talked about, we don't have numbers. People are not giving us numbers, which was true, especially on deaths. There are a lot of people that were told, stay home, stay in your house. There's no record of those people dying at home. How many African Americans are actually losing their lives? These are questions that still need to be answered.
So with you saying that, I'm going to kick it over to you, Legislator Williams, because we have been having these same conversations. The challenge that it is taking to get numbers initially of those who are positive, because these are numbers that come down from the state, then to the county, then to the local communities. And it took us a while to start getting numbers of deaths. And right now we're getting numbers of deaths based on the county, but we don't have information on deaths based on our local communities. But we know that we are being the hardest hit. So if you could kind of share what some of your discussions have been around this.
Yes, first of all, let me thank you for hosting this, Mayor. I think this is great that we're doing this. Let me also say to all of the residents throughout this county who are suffering from this coronavirus and who have been impacted either through family members, losing family members and friends, that our thoughts and prayers are with you, and we will continue to work to make sure that at the end of the day that we are able to address the things that we can, and ask you to continue to pray, because that's what we need in these crises. To get back to the subject of, I think there are two items that needs to be focused on, particularly as it relates to the communities of color, the Black and Latino communities. And it's not only in Westchester County, it's nationwide. I think the statistics are showing that there are disproportionate impacts in terms of confirmed cases, as well as fatalities within these communities. And I think that in order for us to really, without casting blame, but try to get to solutions, we need to have accurate data. Basically, it's got to be a focus on accurate data for transparency purposes and to making sure that people know what is going on within the communities. You cannot resolve a problem if it's based on sketchy data, or if there's no transparency as to where deaths are occurring. How, it's hard to inform people in a way that would be meaningful if you don't have data. So that's one of the things I think as a community, we have to really kind of push for and really make it at the top of the list. Transparency, accuracy. The second is testing. I believe that it's very clearly that we have to have a clarion call for testing in communities that have been disproportionately impacted. Communities where you're seeing the large disparities. The disparities are not even questionable. I think everyone knows that these disparities exist. And we can go into details later on about why the disparities are. But the fact of the matter is that there are basically these disparities, and decisions are being made now as to whether or not the curve is flattening and what should be done. But before those decisions are made about whether or not we are seeing a flattening of the curve, we need to know that there is some focus on greater testing in areas that are experiencing these disparities. And those are the questions and the discussions that I've had over the past couple of weeks about try to moving this discussion forward, because we need to get those results.
So, you know, one of the things that has been very helpful is when some of the state and the national, well, really New York City statistics started coming out, because New York City has been collecting this information based on gender, based on ethnicity and community. The state not necessarily has been collecting the information, or at least they say, on ethnicity. And so when we've looked at the numbers coming out of New York City, we were able to confirm that in New York City, and we would say the same as for Mount Vernon, Yonkers, and the rest of Westchester, Peekskill, all of us, that Black and Brown communities have been disproportionately not only exposed, but also are dying from this. And we know a lot of that has to do with comorbidity, like high blood pressure, diabetes, asthma, obesity, high cholesterol, heart disease. We know that this impacts us, but we've been able to take some of that data from New York City, as well as Chicago and DC and Michigan, and really begin to push the conversation again with our state representatives and legislators, with the governor's office, and say, look, in communities like Mount Vernon and Yonkers and Peekskill, we need testing sites. We need testing. Yes, it's nice that there is testing available in New Rochelle, but it takes me 15 to 20 minutes to drive to that testing site. And I have a car. Now, for a lot of our residents, those who are most hardest hit, those who are underemployed and now maybe unemployed and don't have transportation, it's going to be hard for them to get to New Rochelle. And so we have, you know, I'm really, really grateful. I've worked with, of course, our county legislators, and our county executive and deputy county executive have said that they would echo our sentiments on the state level, but we really reached out and have been working with our Assemblyman Pretlow, our Senator Jamal Bailey, as well as our Senator Alessandra Biaggi. But we've definitely also taken it up and reached out to our state majority leader, our Senate Majority Leader, Andrea Stewart-Cousins. And so, you know, we feel that testing sites in our local communities are imperative. And the reason they're imperative is because if we're being impacted in greater numbers and greater percentages, and then we're dying at higher and disproportionate rates, then we need to identify infection and exposure in our community in an earlier stage. If we can catch this in earlier stages in people, we can begin to get them treatment, and we can begin to help isolate them when they need to be isolated. Then we can reduce the spread of the contagion, and we can ensure that we are catching this and attacking this at earlier stages. And that's why testing in our local communities is so critical. And I'm just glad to have partners like yourself and our state representatives to help us here on the local community, in the local communities, make that push. I want to pull into the conversation only for a second because we can't see him, but our legislator Alvarado, ¿cómo está mi hermano? ¿Cómo está?
Muy bien, gracias, señora alcalde. Thanks so much. Well, here in Yonkers, if the numbers continue to increase in the way they have, we should have by today over 2,500 cases locally, which definitely, and my colleagues Johnson and William on this program have already begun to discuss why the disparity of the numbers. Obviously, it's no secret that 72% of deemed essential workers are us, Latinos and African Americans. You know, very often with no protection early on, you know, we had no clue what we had at hand. So right. A lot of us were deeply exposed, never mind the morbidity because of our diet or culture or genes. We are the front line for the most part. And people need to realize that that when it comes to services and the stuff that nobody else wants to do, we're doing it out there. And in the process, we've gotten infected, and we need to know right away. And I echo what you're saying to the state, to our local executives, majority leader in the state, everybody, come and help us get testing ASAP so that we can begin to properly quarantine, isolate, and so on and so forth, so that we don't continue to lose this number of people. See, it is a crisis, and Yonkers is worse than our shell now. We hit the worst overall. I mean, in proportionate, Mount Vernon, because of its density, similar to what Chris and I represent, Southwest Yonkers, we are in the thick of things. We're losing loved ones left and right. Remotely, I have attended 3 wakes already, and something's got to give. Mayor, thank you for doing this, and I'm sorry, this is my first Zoom, as I admitted to you before, and I was not readily prepared, but thank you for doing this, and I just want to let everybody out there know that we're partners in this, that we're together with you, we're together for our people, and ready to do anything physically, anything possible at all. Count with me in support of all of us together. I think we can definitely bring some change to the numbers, to the information. And please consider me a partner. Call me anytime. I'm available. I'm available anytime, ready and able. Thank you so much for doing this, man.
You're welcome. And County Legislator Alvarado, if you could just give us a 2-minute message in Spanish for our Spanish speaking public, so that they can hear and hear it in their language. If there's anything you want to say.
Claro que sí. Colegas hispanos, es muy importante que sigamos el mensaje que está allá afuera, que nos protejamos, que utilicemos nuestras máscaras, que mantengamos la distancia social de 6 pies, que limitemos nuestra salida al supermercado, a las tiendas, y si tenemos que salir absolutamente cuando sea necesario, mantener esa distancia. Protejamos a nuestros familiares cuando nosotros salimos a la calle, y muchos de nosotros somos jóvenes y probablemente vamos a sobrevivir a esta enfermedad, pero nuestros ancianos, nuestros viejitos son los que están prominentes a morir si nosotros traemos estos virus a nuestras casas. Por favor, mi gente hispana, quédense en casa si no tienen que salir. Si tienen que salir porque son trabajadores esenciales, protéjanse y exíjanle a sus empleadores que les den la protección necesaria. Si no, lamentablemente, van a ser contagiados y van a enfermar a gente que de verdad puede morir. Ya he perdido 4 personas muy cercanas a mí, que no perdamos a nadie más. Muchas gracias, señor alcalde, por permitirme mandar este mensaje en español. Thank you, Mr. Mayor.
Gracias. And so in short, for those who don't speak Spanish, he basically said, maintain the social distancing of 6 feet. When you're at the supermarkets, maintain that. When you're going to the stores, if you're not essential workers, stay home and help, flatten the curve of coronavirus in the community, that we're losing too many people in the community, and that the only way that we're going to stop this is if that we stay at home, and when we are in public, that we have to social distance and we have to wear our personal protective equipment. So thank you so much, County Legislator Alvarado. And since we are still here in the city of Yonkers, we want to pull in our County Legislator and my brother, Christopher Johnson. So Christopher, please unmute yourself.
Got myself on mute because 3J was having some fun over there on the side, and he didn't want to share. He wanted to share with everyone, but I didn't think what he had to say was necessarily appropriate. But first I want to, wish everyone in this time all the best. I know it's difficult for all of us, but especially for those who have family members, friends, or who themselves are physically dealing with this, or have had someone, or know people who have passed. it's not easy normally under normal circumstances to lose someone. But under the circumstances that we have today, where it's difficult to, you can't be with the person when they're in that moment, and it's difficult to plan their homegoing after that. It is truly a trying time, and my thoughts and prayers and my heart is with all of you, especially on this Resurrection Sunday. But as you were saying, Madam Mayor, just talking about disparities between communities, and similar to what Legislator Alvarado mentioned with disparities in essential workers, how we're in grocery stores and we're doing deliveries, there's also the disparity in our healthcare system that exists.
Yes.
So we've seen, especially in our recent history, Black women who are giving birth, right? Not be listened to and believed with the physical ailments that they're dealing with. When you almost lose someone like Serena Williams, and she's giving birth, you know that this is not a financial thing. You know that there's a racial component to it, clearly. And so when we as people of color, Black people, Latinos, and others show up to a hospital and are asking if we can receive a test because we're having these symptoms, it needs to be incumbent upon individuals in these healthcare spaces to recognize that we are telling the truth, right? Believe us as individuals that we are having these ailments, that we are going through these things, and that we need to be admitted. And I think as long as we have only hospitals doing testing, as we have in Yonkers right now, you're going to continue to see these disparities. And that's why I thank you for your push at the state level to push for a testing site. I know I've reached out to our state electeds, and I've seen some actual language in the press from some of our state electeds pushing to make sure that we have testing in these.
And I want to just say our state Senator Shelley Mayer has also been involved in this conversation as well.
And I know I've seen Assemblyman Nader Sayegh. He put out a press release asking the governor to consider us having one here in Yonkers because it's truly necessary. And you know, I want to say that it's tough when you don't see your electeds all the time. You're used to seeing us out at events shaking hands, and they say shaking hands and kissing babies, right? Yeah. And so now in this time, people are like, well, where are you? And so you have a number of specifically executives, in my opinion, like yourself, Madam Mayor. You've seen the governor, obviously, on his daily press conferences, who are really out there, who are pushing. The county executive is visible daily. And so you start to ask, where are the other electeds? And I think that you heard Legislator Clements and Legislator Williams talk to the work that we're doing behind the scenes in phone calls and writing letters and making sure that people who can create this change, whether from the private sector or our partners in government, are hearing from us on a local level. I've tried similarly to find my role, to find my space in this, in making this a little bit easier for some people. And so I received an email from a Yonkers resident who is a nurse and wanted a place to stay because she didn't want to carry all the COVID positive germs, right? That she was around on a daily basis home to her family. And so we were able to find a private donor to set her up in a hospital for 11 days. But we just can't do that for everyone. And so trying to come up with a more permanent solution. And I think at this point, it looks very hopeful that Mercy College, who purchased College in Rochelle, hasn't had anyone on campus this year, and that they may allow for some of their dormitory space to be used. It's been a challenge with other dormitory space with like Pace and Mount St. Vincent and the like, because students left thinking that they would come back after spring break. So all of their clothes and other belongings are still there. And so without displacing students and their personal belongings, how do you activate that space? So thankfully, Mercy College has some space in their shell that we hope to be able to be used. And we'll, sometime this week, we'll be making a formal announcement.
And thank you so much, Legislator Johnson. That is incredible work. It's so important. You know, we're dealing with the potential closure still of Mount Vernon Hospital. And so we've been working very closely with NISNA and NISNA representation and speaking to our nurses on almost a daily basis. And I can tell you, I have a lot of nurses who are personal friends, a lot of healthcare workers and doctors who are personal friends who have the same concerns about becoming infected and bringing this home to their family. I have a friend who became infected, and you know, husband and mother-in-law and children have been infected and affected by this. We've seen healthcare professionals die. We have seen hospitals terribly, terribly short-staffed because, you know, COVID doesn't have any respect. You can have on PPEs, and we've also, if we're honest and if we're truthful about this, because people need to really understand, nurses, doctors, healthcare workers, fire, police, first responders, essential workers, you know, we've been in short supply of personal protective equipment, and people have had to reuse equipment. They've, you know, they put equipment into the bin and it's kind of recycled and maybe cleansed a little bit or sprayed down with Lysol and given back out. And we're seeing some loosening and we're getting more equipment in. But I can tell you honestly, for our frontline workers and our healthcare workers and everyone out there, it's been very, very difficult to protect them because of the lack of the equipment that was available. This is something new. We had to ramp up for this. And unfortunately, a lot of this equipment is made overseas, and you know, you're fighting with the federal government and FEMA. They're trying to get it for the states that they're trying to cover. And we know that it's not equal. We know there's major politics involved in this. And so states that support our president are getting more support and getting those PPEs to help ramp up. Whereas a lot of the states that did not necessarily support some of the federal leadership, we were forced to fend for ourselves, and our governors and our county executives and our mayors have been fighting to find equipment for their communities. And so it's been a really, really hard ride, but you know, we are doing this together and we are standing together, we are unified. And that's the only way that we're going to get through this, is get through it together. So thank you so much for taking lead on finding a safe place for our nurses and some of our healthcare workers to stay, because going in and working 12 and 24-hour shifts and being exhausted and then trying to go home and properly decontaminate yourself so that you don't expose your family is very difficult. And staying in hotels for $80, $100, $200 a night in our very expensive county is not an option for them either. So thank you. And I know that will go a long way in helping to bring peace of mind and a sense of safety and security. And then also probably allowing us to maybe recruit some nurses from out of state, because that's been a challenge. Is all of our hospitals are terribly short staffed. As you know, healthcare workers, they get infected, they go out for several weeks and they cannot return. And so bringing in volunteers from out of state is important, but we have to have a place to even house them so that we can receive the help. So we look forward to hearing an update on how that's going, and we'll be praying that that helps. So thank you so much. I want to pull in our legislator, Colin Smith, from the North County up there in Peekskill. You're up in the right-hand side of the left-hand side of my screen. So yes, he's up north. Colin Smith?
Up north.
Yes, up north.
Mayor Patterson, thank you for inviting myself and the other legislators to join in this evening. And happy Easter, happy holidays to everyone out there who might be listening. Happy Passover if you're celebrating. Even though I know it's a couple days now. So a lot of good stuff has been discussed here this evening. You know, I've been monitoring the you know, like all of us, you know, the stats daily. Being that we are relatively confined to you know, staying indoors nowadays, social media has become more important than ever in terms of being able to communicate with and interact with people. And I've had a fair amount of contact with constituents through Facebook and through emails and text messages, which that's not totally abnormal, but certainly that has increased during, under the current crisis. One of the things I've noticed in looking at the numbers, I think the numbers that came out either yesterday or today, just as between Yonkers and Peekskill, I think Yonkers has roughly 2,500 confirmed cases. Peekskill has roughly 250 or so confirmed cases. And I believe, without knowing, I'm not sure what the last census was in Yonkers, but I know the last census in Peekskill was that we're around the 25,000 population mark. So that puts us at 10%. 10% of our I'm sorry, not 10%. That puts us at roughly 1% of the population here, which is significant. It may not sound like a big number one, but when we're talking in terms of rate of infection for a disease that we have no known cure for, no vaccine for, that is a very scary number. And I can just say that I don't know. Like you said, I would love to have more information related to fatality statistics by municipality. I know, like all of you, there have been a number of people in my district, some that I've known personally, who have succumbed to this disease, and it really has had such a devastating impact. Not just financially and economically, but of course that is severe enough. But just the morale of the community. People are scared. People are in pain. They are grieving loss. Like yourself, I have a number of friends who are, and acquaintances who are healthcare workers, healthcare providers. I've had several phone calls with some of the local nurses here, in up county here and down county as well. And the situation on the ground is very, it's mission critical, as they say. And the county, as you know, the state, the municipalities have been working hard to try and procure or secure the PPE for healthcare workers, for emergency service workers, and our first responders. But the need is just so great that it is hard to meet that demand. At least that's what I've seen up to this point. So to talk more specifically about the minority community and how we've been impacted by this, and I was happy to see, as has already been mentioned, that Governor Cuomo had started to release the statistics earlier in the week related to ethnicity, gender, and so forth. And if as we all have been, watching the media reports, the news coverage across the country, we're seeing a very similar trend in other urban, high-density areas where the African American and Latino communities are disproportionately impacted by COVID-19. And here in New York, our fatality rate is double that of non-minorities, and that is just a staggering number. Of course, we do know, there's factors that many factors that go into that. One of the big factors just being the state of healthcare in our community, the healthcare. And I've had a lot of conversations, as we all have, and I know as you have, Mayor, with a lot of people throughout, over the last several weeks. And when we get through, we will get through this crisis, right? We will get through it. We will not get through it without, without casualties, unfortunately. But we will get through it. We will heal. And then we will start having to think, and I think conversations need to start happening now about what are the issues that we have to address moving forward to ensure that we don't end up in this situation ever again.
Ever again.
And I think that's, the conversations that we should be having more and more going forward. How do we ensure against this from an economic perspective and from a healthcare perspective, as it relates to communities of color? So, thank you for.
So definitely, thank you so much. Thank you so much, Legislator Smith. And so, I worked in Yonkers for 12 years. I sat on the board of directors of St. Joseph's Hospital. And St. Joseph's Hospital always reminded me so much of Mount Vernon Hospital. Hospitals that are right in the middle of heavily, densely populated Black and brown communities, hospitals that are under-resourced, hospitals that are always under, threat of closure or reduction of services. And, what do we need to do? What is the answer? How do we need to support these organizations? Because when we're talking about infection rates, we're talking about social determinants of health. We are talking about, and for those who don't know what social determinants of health, they are what social determinants of health are. They are the social issues that determine health outcomes in a community. And so they are housing, they are education, they are transportation, they are the built environment, the density, whether it's apartment buildings, it's the built environment and how that community is built up or not built up and supported. It is access to healthy foods and fruits and vegetables, but most importantly, it is access to quality healthcare. It is access to healthcare, and it is access to culturally competent healthcare. And I'm going to say that again, culturally competent healthcare. It doesn't mean that you have to have Black and brown doctors, but whoever the doctors are, they have to understand the history of the people in the communities that they're serving. They have to understand some of the historic distrust. They have to understand some of the social norms that impact our day-to-day living and our culture. And they have to also understand that oftentimes the resources that are available to us are few and far between. And so it's very hard to get people to trust. I was looking down a few minutes ago because I was looking at the comments on this live, and there were quite a few comments saying, yes, we go to the hospitals and we ask for testing and they don't test us. Or when they do test us and tell us we're positive, they don't really tell us what to do, and then they send us home. So what are we supposed to do? And so on Tuesday, I'm going to have hopefully our county commissioner of health, Dr. Amler, on this platform so that we can discuss that, because it's not just about getting a confirmed test. While people are waiting to be tested, if you're experiencing symptoms, people are saying, well, what do I do? Because you could experience symptoms and they don't test you because you're not sick enough. And so you're sitting at home, and what can you start to do when you're experiencing symptoms? A lot of people have said, and those who have come through have said, hot teas, lots of hot tea with honey, with ginger, with lemon, different oil of oreganos and vitamin C and citrus fruits and alkaline water and different over-the-counter and natural remedies. Use Tylenol as opposed to Advil and things of that nature for the fever and to break the fever. But we need to hear this from the medical community, because if I'm exposed tomorrow and I start experiencing symptoms on Wednesday, but I may not get a test, and this is very real. And so people can say and challenge me on it because I have the proof to back it up. There have been people who have been multi-symptomatic in this county, and it's taken them 2 weeks to get a test. And by the time they got a test, they were already ready to go back to work because they went through their symptoms, their families took care of them at home. Thank God some of them didn't progress and need oxygen or a ventilator. But then there are others who don't have advocacy and may not have families. And these are the people who our morgues and our county medical examiner is picking up all over the place because they're going home to die. They're going home. Not everyone who's dying is dying in the hospital. There are too many people who are going home to die because they have asked for medical support and medical attention, and they have been refused it. They have been turned away at emergency rooms. They have been turned away at testing centers, or they've been waiting on phone calls from testing centers so that they can go in and get a test and some further direction as to what to do. And it didn't come. It didn't come. And so, as people say, miss me with some of the politics around this. People are dying. Our communities are hurting. Yes, people are scared. We are tired of seeing all of the rest in pieces and the sleep in peace. It's so much death. It's something that we've never seen. And we're dealing with fatality management. We're dealing with no spaces in the morgues. We're dealing with refrigeration trucks behind all of our hospitals. We're building a temporary morgue up in Valhalla to go behind the medical examiner's office for the numbers of bodies that we're dealing with. And I think to date, we've had 511 fatalities in the county. That's a lot of people. And those fatalities really started happening in the past 2.5 to 3 weeks. And so when you're talking about 150 people and up dying each week in this county, and when you look at it, it's probably more like 55 to 60% of those people, honestly, live in Mount Vernon and Yonkers, are impacted in our densely populated neighborhoods. It's sending all of our communities reeling. I participated in a motorcade yesterday for a friend and a mentor who lost her life, and her sister died a few days before that. Today, I participated in a motorcade in Yonkers for our detective Sullivan, Billy Sullivan, and who was a longtime officer and a lifelong resident of Yonkers. And all of us, every single one of us on this Zoom have lost, whether it's family members or friends or colleagues, people we've gone to school with, people who have, spoken into our lives, friends, children. Everyone has been affected. And so we really want to see a greater coordinated effort and an increase in resources brought into our communities that are being hard hit. We don't just want to see a response now, but we need to start building for how we continue to address this in the future. The economic development of our community and redevelopment and revitalization of our community, we know are going to be slowest, because historically it's always been slowest. Our communities have always been the slowest to recover. And so we have just a crisis that none of us have ever seen before, but we all have to come together and become very innovative, very creative, and really work cooperatively, because a rising tide lifts all boats. And if only parts of our community rise and other parts of our community stay economically depressed and unhealthy, we're not going to have a healthy county. We don't want any rotten pits in this golden apple of Westchester County. We want all of our communities to be able to shine and all of our residents to have equal access. So equity is the key, and a quick response to what we're dealing with is critical at this time. Do we have anyone? I see Lyndon, come on in.
Yeah, I just want to say that the issue of testing is not only testing, but what is being done after testing.
Yes.
Clearly, we need to have more testing. But when you have a situation where you're testing and one does not have symptoms, right? But that person may have a comorbidity. The question is, why send them back home? We have to insist that not when they test, that even if the person does not have symptoms, that they determine whether or not they do have comorbidities that may result in further detrimental situations. Should also inquire as to the house situation, the home situation.
Yes.
When you send someone back home, if that person is in an apartment that social distancing is not practical, then what you're doing is sending them back home to really infect their families.
So to speak to that specific issue,
yeah.
I had a really great conversation on Friday with our Deputy County Executive, Ken Jenkins. And so they are providing additional resources, especially to these hard hit communities, where we are going to be working with those persons who are testing positive, who have to go back to a location where they're living in an apartment or a multi-generational household, and identifying whether or not these people have the ability when they go back home to social distance and isolate. And if they do not, then we can either relocate that person or we can help relocate the family so that we're not spreading contagion once a person returns home. So that is a conversation we're having.
Yeah.
Another conversation that we're having is expanding resources to the communities to provide food. And so they'll send some refrigeration trucks down so we could expand our food delivery, and also doing some more community education, helping us, produce this information and responses to frequently asked questions and hit the streets, utilizing our police departments, our fire departments, and some of our other staff in the community that have been redeployed or who are working from home, and literally go out into the community and hand out information and put things on people's doorsteps, because not everyone has Facebook, not everyone has social media, not everyone has internet, not everyone has cable TV, where we're putting a lot of this information on public access. So we're going to do that old time street campaign to try and get information and resources out to people as well.
I had, and I want to give the county executive and his team a lot of credit, because I had these discussions with him about this last week also, about the fact that the density in the county differs. And in areas where you have density, you have areas of high risk. Mm-hmm. And we have to kind of talk about, and it's not within his purview alone, obviously it's a statewide issue, but we have to insist that in terms of treatment, the data that they gathered, the data on comorbidities, the data on community that had high vulnerabilities are not data that we're now learning. There have been studies done in this county and this state for years. You can go back and pull them. So you can, by just having that data, the studies, tells you where critical resources are necessary in the pandemic when it comes to a point where you're seeing the fatalities get kind of escalating. And I'm not saying you do that at the expense of other places. You don't have to do it at the expense of others. You don't want anyone to do it. But basically, you cannot ignore the situation where you have high risk. You address high risk by putting resources where high risk really relates. And I think that is it's a learning process that we are going through as a nation. And I'm hoping that at the end of this, we're going to get to the end of this, as Legislator Smith said. But if we get to the end of this and these discussions just become, platitudes and no analysis in terms of what occurred and what could have been done, then we would have wasted a lot of time and people would have lost their lives in vain. And that is something that would be a disgrace for us. So I believe that we have to insist upon, as we go through this, that we need to make sure that the data that's being accumulated, and because if it's not used to kind of solve problems in the future, then we would have actually not learned our lessons, because we did have data about comorbidities for decades. We should have known.
So Lyndon, to your point, back in 2004 and 5, myself and Cheryl Brennan and quite a few of us sat on the county executive's Blue Ribbon Task Force for the Elimination of Health Disparities in Westchester. So that report is available, it's accurate. The same information we collected back in 2004 and 2005 is still relevant today. So we don't need to go back and necessarily convene another task force to study it. Now we need to convene a task force to update the information and then implement action and change so that we can move forward and that we can be not just Westchester, but Bestchester in creating some best practices that the rest of the nation can really follow. We don't need to just reinvent the wheel, but we can definitely move forward.
I think for so many of us who ran for public office, right, it was for a moment like this where we recognized what these disparities were, right? We have always known, as people of color who have been through this, who live these lives every single day. We've always known that what these truths were, and we know that in the halls of government, in cabinets somewhere, this information is on paper. And it is in this moment and moments like these where we need to step up and take this challenge to change all of that. If we can't allow our colleagues, we can't allow the private sector to say, oh, that was a moment in time and let's move back to how things were yesterday. We need to make sure that things change so that when something like this happens again, because it will, this will not be the only time that we in this nation, that we as a planet see something like this. But the next time that we do see something, that we're prepared and that we don't see these type of disparities in our communities where people that look like us are dying with information that we knew would challenge us in our communities.
So,
it's unacceptable.
Colin, Legislator Smith?
Yeah, and just to that point, you know, and I wasn't aware of that 2004 study, but I'd like to get my hands on that, have a look at it. You know, one of the things I've since, you know, we've had a little more time on our hands lately, or at least a little more time to be in one place, is I've read a little bit, you know, just sort of, you know, on the history of outbreaks and epidemics. And one of the things, and of course I'm not a doctor or scientist, or I have none of those qualifications, but one of the things I think that has been talked about a lot in the media, and that has been characteristic of outbreaks in the past, is that they're typically, or it's not uncommon for there to be a second and maybe even a third wave of infections when these things occur. And I bring that up just to say that I think that collecting the data now is not only going to be just relevant for analysis purposes, but it could very well be quite relevant in the short term if we are potentially going to be, if we at some point face a second or a third resurgence of this in the coming year and a half. Having that data will hopefully better prepare us to deal with that, because even though it may not be as impactful in less densely populated areas, more rural areas, although clearly the virus is everywhere at this point. But it's obviously having more devastating effects in the urban areas and the more densely populated areas. I think it's important that we expand the testing as much as possible. And I've been listening to the governor of New York, and he seems to be saying that they are moving in that direction as it relates to increasing testing in neighborhoods that are communities that are most impacted. But I think it would be important just for us to know. It will be important for analysis, but there'll be a practical importance of it, because if in fact we do face a second wave of this come the fall into next winter, we're going to need to deal with that, and having as much information, having done as much testing as possible will help us, will inform our decisions with regards to public health policy.
And so I'm pretty confident. I've heard over the weekend that new testing centers were going to be open in some of the urban areas in each of the boroughs in New York City. And I know that our advocacy here in Westchester has been consistent, has been strong. We have presented our argument and our numbers. And so, I have a strong belief that we will see some movement on this in Westchester, in our most densely populated communities. Like I said, we are working with our county representatives who are supporting us in this, but this is something that we've had to push on the state level. And so it's really been spearheaded with the mayors working and with our county legislators and our county executive, but really having our senators and our assembly people who are our state representatives lead the way. The hospital sites are nice. And we understand you can get tested in an emergency room or an inpatient if they determine that you're eligible. But our county Department of Health, I've worked with the Westchester County Department of Health since about 1992. First in the AIDS pandemic, and working with their communicable disease division, and the work that we were able to do through the Westchester County Department of Health Communicable Disease Division and Community Health Division was historic in getting out and testing and tracking and identifying and getting critical services to the hard hit communities. So the County Department of Health does have that capacity already, and they, definitely need to be activated in this. And hopefully the governor will support that. And then also working with our local health centers. Here in Mount Vernon, we have the Mount Vernon Neighborhood Health Center. That is a perfect location. It's right in the middle of the community. It's right in the middle of some of our most densely populated neighborhoods. We have the Yonkers Health Center. We have health centers on South Broadway in Yonkers, in the neighborhoods that need to be served. In Peekskill, you have the Peekskill Area Health Center. So it is the health centers, it is the neighborhood health centers that we really, really need to engage and pull them in on the front lines. They are trusted providers. Sometimes when our hospitals have failed us most, it is the access to our neighborhood health centers and pulling them in to be partners with us in this work that has really, really made the difference. And so I've been speaking to Judith Watson, who is the executive director of our health center here in Mount Vernon. And I know that they are on board, they are supportive of this effort, and they are ready, but we need the resources. And some of the resources that we'll need, other than testing centers, will be people to help us with traffic control as well as security. Our local police departments are not necessarily equipped and able to do this. All of our police departments have been hit. Our police officers have been exposed, and we have police officers who are out. And so, we may need, like New Rochelle received, some help from the National Guard. And when we say that, there's a difference between bringing in the National Guard to police our streets and bringing in the National Guard to help us provide services and supports around testing and food delivery, or some of the other supportive services that we need to do. I was at Mount Vernon Hospital yesterday. The tent that we had to use as a screening tent was damaged by the wind, and the National Guard came out along with our Westchester Emergency Operations Center. They pulled down the damaged tent, and within an hour and a half, they pulled one down and they put a new one up and erected it, and it'll be back open and ready to go. So the National Guard is not just called in, in times of protests to kind of police communities, but the National Guard can be called in to support us in different ways. And we might need some of that support as our first responders have been hard hit, and our departments are stretched right now. So I believe that I would be open to that level of support. We don't need the National Guard to police the community, but we might need them with testing centers and some other essential services that they could provide in the community. And so I just want to make sure our legislator Clements and our legislator Alvarado, who is not seen on the screen, but who is with us. Do you have any closing comments?
Yes, I think some of the things we can do now, one of the situations that happened here in New Rochelle was that food comes from the high school cafeteria, and they found a worker that was sick. They had to close it down. So that meant the food distribution at some of the elementary schools where parents could come and pick up breakfast and lunch were disrupted. And I believe that if those workers had been tested for fever, it might have helped so that we could intervene in a timely fashion and things didn't have to be shut down. Also, Hope Community, they are concerned about making sure that they're servicing seniors and having enough volunteers. They've had people also get sick who can't go out and serve the seniors the way they've done that. They also are concerned about a National Guard being redeployed in another much needed area. And they say at this point, we have to look forward to where our resources can best be used. And also, will they be, do we still need them? Do they need to be redeployed, the National Guard? And we have to be supportive of our local, talked about health centers, but also of our local nonprofits that are really serving the people of Westchester.
So I just, one more question, Legislator Clements. You've had the National Guard in New Rochelle for a month or a little more than that right now. Have they been respectful? Have they been helpful? Have you found them responsive to the community?
Oh, absolutely. They have been giving out food at 95 Lincoln. They've been working at the testing center. They've also been helping at the community help, Hope Community Center. They have been around different areas of New Rochelle, definitely helping out. We've also have some of our elected officials there with them, giving out food. And we have several churches that also have been giving out food. And they have, they've been absolutely amazing. That's all I can say. Those young people that are in National Guard have been absolutely amazing.
And whenever the National Guard has come to Mount Vernon to help deliver some supplies, they've always been respectful, they've been professional, and many of the individuals who are working in our region right now from the National Guard are from Mount Vernon, New Rochelle, Yonkers, White Plains, Peekskill. These are Westchester residents. These are not people who are coming in from Dallas or upstate New York. They are our community residents right now who are serving us through the National Guard. So I just want to know, for those who are concerned, in maybe some higher levels of government, that as a Black and Brown and as a very mixed community, we don't fear the National Guard coming in, as long as they're coming in to be supportive and to be more hands to make our work lighter. We welcome them, we appreciate them, and that there is work for them to do here. Legislator Alvarado, any closing remarks?
Sure. Thank you so much for having me. Kudos to the National Guard, absolutely. Nationally, locally, the feedback is that they've been doing a great job. We hope to welcome their help when we have our testing center to help us set up. I know that the mayor has made the request to the state, and that things are moving. I'll be happy, and I'll make a pledge to you, Mayor, that I'll be ready to be totally visible next time. I did not prepare, as you know, when you called me, I was getting outside to do a distance, proper separation, egg hunting with like the 4 kids in the house, and by the time I came
you were
back,
spending time with your family. No apologies for that.
And social distancing was applied.
Yes.
And I hope that when we get back together, if you have me, that we can be talking about improvement, how we are going to manage our new normal. I know that here in Yonkers, we are the epicenter of Westchester County. Not proud of that, but we should be able to manage this thing. There's so much to learn from New Rochelle in the way that was handled. And we get the updates from the governor on a daily basis, very accurate information. Unfortunately, as has been mentioned in this call, the information doesn't drift to our neck of the woods in the way it should. But I look forward to coming back and continue. And we have translated information to the Hispanic community, what to do, what needs to be done. If you don't need to do anything else, people, please stay home. And if you do go out, do it with proper distancing and protection. Mayor, thank you so much for having me. I look forward to coming back on again at the nearest convenient time when we can hopefully report on progress.
So I just want to thank everyone here who has joined us. And we did not get an opportunity to get to the census, but if everyone agrees that the census is important, can you please wave if the census is important in your community?
Yes.
So we need all of our constituents to go out and participate in the census. We need you to go to mycensus2020.gov and complete your census. You can also call 1-844-330-2020, that's 2020, and complete your census on the phone from 7 a.m. to 2 a.m. That's 19 hours that the census people are available to chat with you. And since you're staying home, you have that time. This takes 10 minutes or less, and it's $800 billion a year that is distributed from the federal government that comes down to states, counties, and local communities for everything from housing to road repair to fire and police to education, to healthcare, job training, economic development, mental health services, youth and senior services. So everything that we need in the community is based on our census. And unfortunately, oftentimes the people who need the services the most are the ones who are least likely to fill out their census. And our communities have been traditionally undercounted, and we cannot afford to lose hundreds of millions of dollars over the next 10 years because we did not fill out the census. You do not have to be a citizen. You don't have to be a legal resident. You just have to be a person who lives where you live in your community to be eligible to fill out the census. So if we don't know you're there, we won't get the money to serve you, and we're going to still have to serve you anyway. So please help us get the money that we need to provide the services that we need to provide in our communities and to make a difference. And I just want to say to everyone, please continue to have a great Passover with your family. Let's continue to celebrate Resurrection and Easter Sunday. And let's continue to encourage, minister, pray for, lift up, provide mental health check-ins, do family Zooms, chats, FaceTime, whatever you need to do to stay connected to the people who you love, care for, live near, and miss. Do that because, you know, social distancing is critical to help us flatten the curve, but we still need to find a way to tap in and have communication and some type of socialization with those we love. So people have used Zooms and other platforms, even within their families, to stay connected, check in on someone. Don't worry about being in people's business. Right now, we all need a little extra TLC. We all need a little extra encouragement. And so I want to just end out the show with Danny Wancho, who is a Mount Vernon resident, and Malcolm is going to put this up on the screen. And this goes out to all of our families, friends, and neighbors who have lost a loved one. Please stay home and save lives. And here is Danny Wancho. God bless everyone. Thank you.
Thank you, Mayor.
Thank you.
Thank you. Take care.
Thank you so much.
Thank you, Mayor.
Thank you.
Take care.
Take care. All right.
Good night.
Mayor,
Good night.
have a good night, everyone.